everyone, and welcome to a new four-part interview series, Cat2Vet Tales. For the next 4 weeks, I'll be talking with veterinary experts and cat welfare experts all about keeping our cats healthy at every single age. I'm so grateful to be able to collaborate with Royal Canin on their Catology series, as well as the Take Your Cat to the Vet campaign. This is a campaign that's very near and dear to my heart because 50% of cats in the United States don't receive veterinary care on a regular basis. And we hope that we can change that by having these important conversations to help people learn the signs of illness and to encourage people to take their cats to the vet on a regular basis. So this is a continuation of the Catology series from last year. If you have not watched the Kitten Lady and Friends interviews and the webinar series, I highly recommend that you do so. There's hours and hours of educational content that you can find at kittenlady.org/catology. But today we are going to be kicking off Cat2Vet Tales with a familiar face. You might remember her from Kitten Lady and Friends last year. Her name is Dr. Tanika Bautista. She is a director of veterinary quality at Banfield Pet Hospital, which leads the way in sharing animal data and insights based on analysis of health records from the millions of animals seen at their practices each and every year. So today we're going to be talking about something that is at the front of my mind these days, which is renal and urinary health in cats. Dr. B, thank you so much for joining me today.
Absolutely. Thank you so much for having me back, Hannah. It's a pleasure to be here.
Yeah, it's really good to see you. And last year when we spoke was the beginning of the pandemic. You had just adopted 3 kittens, which was amazing. And I have to start by asking, like, how are your cats? How's that going?
Um, Thank you for asking. They're doing amazing. So I have a total of 5 cats now.
Yay!
Yeah. So I've always had Peaches. She's my 8-year-old girl. She's kind of like their auntie. And then I adopted Starburst. He is he's the black one. He's the rambunctious
Oh.
one, and very vocal. He always has a lot to say. There's Twix. He's my little boy. He's very curious, but kind of mellow little guy. And then there's Skittles there in the front. And Skittles, she's a little bit more shy, but she's a doll and she just kind of likes to hang out. And then there's Milky Way in the front. So as you can tell, all names from candy. I like to have food names. But they're doing
I was gonna
amazing.
say those
Yeah.
are such precious names. I love those.
Yeah, thank you.
Those are
Yeah, they're
great
doing great.
names.
Last time we talked, they were getting ready to get spayed and neutered, so that's all done. And this year, we're just going to be setting them up with their preventive care, wellness exams, oral health exams, and I'm trying to manage their weight.
Oh, wow. Well, they're so lucky to have the family that they do. I mean, talk about good luck for a cat to get adopted by you. It's like that is the jackpot.
Yes.
So last year you adopted, and this year I actually just adopted a kitten. So I wanted to show you my little guy Ferguson. Ferguson is just about 16 weeks old now, and I've had him since he was just so tiny. And the reason that I'm really excited to talk to you about him today is because he's actually going through what we're going to be talking about. Very, very uncommon in a young kitten, but unfortunately much more common in adult and senior cats, which is kidney disease. So I feel like it's a really, really great opportunity to talk about that right now with you about renal and urinary issues in cats. So I appreciate you talking to me about all this because this is very present for me right now. In fact, yesterday I had his follow-up appointment at the nephrologist, at the kidney specialist. So
Yeah.
this is just, I'm living and breathing kidney disease, feline health right now. So I wanted to ask you, because since sharing what's going on with Ferguson, I've had so many people reach out to me and say, wow, this is what my cat is going through. I wanted to ask, in your experience at Banfield, how common is it for cats to come in with kidney disease?
Yeah, that's a great question. And I just want to say he is so adorable. What a little
Thank you.
angel. I love his eyes. Like they're just so big and just gorgeous. So I'm so glad that he has you to take care of him.
Thank
But to
you.
answer your question, so chronic kidney disease is a condition that we've evaluated through our Banfield data that you mentioned earlier. And roughly 10% of the cats over age of 10 years old will develop chronic kidney disease. And actually, it's 4 times more common in cats than in dogs. But
Wow.
like,
I wonder why.
yeah, actually, that is still, to be determined as far as what the specific cause of that is. There are some new diagnostic tests that are coming out that are helping to identify cats, potentially being predisposed to it.
Hmm.
But it is more common in cats. Yes.
So interesting. This might sound like a really simple question, but I know when I first started going through this with Ferguson, I needed like the 101 lesson of like what is really happening when a cat has kidney disease. So, very, very basic question. Can you just kind of talk about the role of the kidneys in the body? Like what does a healthy kidney do? And then what is happening in a cat's body when their kidneys are not healthy?
Yeah, absolutely. So our kidneys are really helpful and important for maintaining normal levels of hydration within the body and also removing toxins. So if the kidneys are not functioning properly, and if it's showing up on lab work, usually it's less than 25% of the kidney function that's remaining. And
Hmm.
unfortunately, that means that toxins can build up in the body, and that makes our cats feel very sick. So sometimes they can present with signs of illness, lethargy, their appetite might be decreased, and other signs that can show up as well. And that also includes dehydration, because if the cat's kidneys are not retaining the levels of water that are needed, then cats will become dehydrated. Those are things that can be evaluated on an examination too. But yeah, those are the really important roles for the kidney.
Yeah, and I have to say, when I first started noticing that something was wrong with Ferguson, it was because he was just drinking so much water. And I care for lots and lots of kittens. And you and I both know kittens don't love drinking water. Like they get most of their moisture from wet food, usually. And they might take a little lick of water here and there. But Ferguson would do what I call like fountain tours. We have all these water fountains in our house, and he would like go on a tour of all the water fountains, and then he would come try to drink from my cup of water, and then I'd be like brushing my teeth and he'd be trying to drink water out of the sink, and I was like, this is something is really wrong
Yeah.
here. And that was my first sign to ask for blood work for him. So I'm curious, like, what are the first signs that people usually notice? Is it usually just drinking a lot more water, or what are some early signs that might be an indication like I should probably take my cat to the vet?
Yeah, and you were very attentive and noticing those things, because it was so different for him, and that actually is one of the signs. The reason that he's probably drinking as much as he is he's trying to keep up. The hydration level that his body was at. Maybe he was recognizing, I need to rehydrate, and so to your point, that's not a typical behavior for a kitten, especially when they're on a diet that has a lot of moisture and provides hydration to them. So that is one of the signs that sometimes will be recognized. And then just kind of being a little bit off. It's not as common for cats at his age to have these type of symptoms, and so usually when clients are recognizing changes within their cat's behaviors, it's usually when they're older,
Hmm.
and noticing, my cat's not behaving the same. Maybe the appetite has changed. They are not grooming themselves the same way. Their energy level is different. Anything that is just a little bit off and seems, just curious, why is my cat behaving differently? Those are all reasons to call the veterinarian and make an appointment. because it could be kind of vague signs sometimes, and it's really worth investigating. Sometimes, you might identify something like you said on lab work, on blood work. So it's really great that you requested that to be done. Sometimes blood work is something to be evaluated. Also, urinalysis, imaging, cultures, things like that might be recommended.
Yeah.
And so it was really great that you brought him in as soon as you noticed that.
Thank you. Yeah, well, we knew something was wrong with him, and he was actually antibiotic dependent since he was really young. He would get so sick anytime he was off of antibiotics, and we didn't know why. And then it turned out that it was like chronic pyelonephritis, which was like his kidneys were becoming infected because of this, in his case, congenital issue that he has with his kidneys. So, in a kitten, like you said, it's rare, but in an adult, something that I sort of worry about sometimes is people go, well, my cat's getting older, so it's probably just a sign of aging. But a lot of these signs of aging are actually things that, with early intervention, we might be able to make a difference with, right? So how
Mm-hmm.
important is it to have that early intervention?
Yeah, I think it's very important. When cats are at an older age, or even just, from kittenhood all the way through adulthood, it is recommended that they're getting those evaluations from the veterinarian on a regular basis. And based off of their medical history and their current presentation of their medical condition, the vet will let you know how often to bring your cat in. And we recommend that they come in every 6 months. And the reason for that is cats can age pretty quickly. And in that 6 months, sometimes things may have changed significantly. And it could be evaluated from physical examination, also from blood work. And so that will help to identify early if there is something that's going on that should be, worked up, and more concerns to be evaluated and treated.
Sure.
So, yeah, absolutely.
So, can you talk a little about you mentioned some of the diagnostics people might expect? Let's say you suspect that your cat might be showing some signs of, early kidney disease. You take them to the vet, they do blood work, and then they show you this long list of things you've never seen before. And you're like, okay, it's all these numbers and words that I don't know. Which things are you looking at on blood work that are the most important for kidney disease? And can you help kind of translate that for people who maybe just had this blood work done? What are you looking at, and what does it mean?
Yeah, absolutely. So, usually we're looking for something called azotemia. And azotemia is when the BUN, there's two markers on blood work that we look at, BUN and creatinine. And so when you get your cat's lab work and your veterinarian's reviewing that with you, if those are elevated and at an abnormal level, then that can be an indication to look further. And from there, we look at the urinalysis. The urine should be concentrated. The kidney should, if it's functioning well, it should be able to concentrate urine based off of the hydration level. So, just like people, the more you drink, the more dilute your urine is. Same thing for cats. But if the BUN and creatinine are elevated and the cat is dehydrated, then you would expect the urine to be concentrated. If it's not
Mm-hmm.
concentrated, then that can be an indication that the kidneys are not doing their job.
Right.
And that
So
is concerning.
So it's important for people to kind of have a couple different types of diagnostics that you're measuring against each other and saying, okay, all of these factors together and the presentation of the cat would indicate that's what's going on. I just have to say, Ferguson had a very high creatinine. 5 weeks ago, it was over 4. And yesterday at his appointment, it was 2.8. So it's improving quite a lot.
That is amazing, and
Yeah.
I did see that. You mentioned that on your post, and that's really amazing. And kudos to
I
you.
got teary
I
eyed even talking about it because I was just like, I didn't know if that was possible. And his veterinarian came out and she just came to my car and she went, "You're amazing." And I was like, "What?" She was like, "I don't know what you did. I'm not like," she was like, "I really didn't think it was going to go down." I was like, "Oh, this is great." I mean, I'd like it to go down more than that, but I've had to become so fluent in all of these different things
Yeah.
that now, as soon as she said the number, I was like, Ah, that's awesome.
Yeah, that is fantastic. Well,
That's,
good job. I mean, because like I
thank
said,
you.
it actually also, can affect how they feel. And so the fact that you're seeing an improvement in the labs, it makes you consider that he's probably not feeling as sick as when they were as elevated as they were before.
Yeah. And I
And
mean, I just
that's
want to
just quality.
say for anybody who's watching this, like if you have gotten blood work that's alarming for your cat, like there definitely are things that you can do, and we'll talk about that a little bit shortly. But I felt really scared of this at first, and now I feel like it's like a cool science project where I'm like, my science project is to make this cat be like feeling good, and that's what staying curious is all about. I'm like, I'm curious about all of the new like technologies out there to help kidneys, and I want to talk to like every veterinarian I can, and
Hmm.
the payoff is so rewarding. It's just very cool to see him
Hmm.
feeling a little better, although he'll have kidney issues his whole life. It's for in his case seems now manageable.
Hmm.
I want to
Yeah.
switch gears shortly to talk about urinary diseases in cats because I think that's another very common thing that cats experience. How common are urinary diseases for felines?
Yeah, there's actually, you may have heard of feline lower urinary tract disease or seen that
Hmm.
acronym
Hmm.
FLUTD. And that is also a urinary tract condition that can present with signs of abnormal urination at the litter box and sometimes outside of the litter box. And so the prevalence of that for cats, based off of the data that we have, is about 2.5% of the cats that we see every year present
Hmm.
with symptoms that are involving that feline lower urinary tract disease. Some of those symptoms are cats urinating more frequently. So they're just taking more trips to the litter box. And owners might notice that. Also, when they're urinating, they may be uncomfortable, so they might be straining, pushing. They may be vocalizing out loud because it's creating discomfort for them. And sometimes
Hmm.
that can be mistaken for actually constipation. Sometimes clients think that
Hmm.
they're constipated, but it might be the urinary tract creating that discomfort for them. And then sometimes they just completely avoid the litter box and they might be urinating somewhere in the house, sometimes on cool surfaces. And when the owners see the urine, it might be red tinge, it might have blood in it. And so that is also a concern. And sometimes cats just are licking really frequently in the genital area too. So all
Hmm.
of those things are, potentially associated with the lower urinary tract and worth evaluation. It can actually become an emergency in some instances if a cat is presenting with abnormal urination signs. So that is something that the veterinarian will be able to evaluate from physical exam. And again, just really getting a really good history. So by paying attention to those behaviors for your cat, it helps a lot.
Yeah, and I'm glad that you mentioned behavior here because I think it's so unfortunate. Sometimes I have people, send me a message or leave me a comment. Oh, my cat hates me. He peed on my bed. And I'm like, did you take your cat to the vet? Because a lot of the time, those are not signs of some kind of like emotional behavioral issue. Those could be signs that your cat is, your cat doesn't have language to speak to you. Hey, I'm uncomfortable. Can you help me get assistance from a medical professional? Like they can't
Yeah.
say that. So there are other ways that they say that. And certainly the faster that you can recognize that as not like that your cat is being mean to you, but that your cat is asking you for help, that will certainly help to have the ability to deal with that very quickly. I
Yeah.
want to ask, what are some things that people can do to reduce the chance that these illnesses might happen? We talked about what to do if you see these signs, but are there things that people can do to try to reduce the likelihood that these things will happen at all?
Yeah, that's a great question because, for feline lower urinary tract disease, sometimes stress can actually exacerbate that too.
Hmm.
And so by reducing stress in the home, when you take your cat to the veterinarian, they may ask questions about more about the environment, what's going on in the environment.
Hmm.
Things that can cause stress, we would want to try to reduce that stress. So that could be, things like, a new pet in the home, a new
Hmm.
person, visitors that are there for a long time. It could be something like that. It could be stresses associated with the things that they need, such as food and water. Making sure that your cat has high quality food, fresh water, like you were showing. The fountains are really, sometimes enticing for cats. They like that flowing water as opposed to a bowl that's, just sitting water.
Mm-hmm.
um, them drinking also helps to keep hydrated as well. And then in addition to that, just making sure that they have enriched environment, that they're getting play, that they are having an opportunity to hide or go on high places or whatever type of environment they prefer, and that they're getting the attention that they need. So if a cat has a really great environment, really high quality food, free access to water, and you're identifying also just their behaviors. Are they grooming often? Those can all be indications of being stressed or not stressed, and that can also help with providing a stress-free environment too.
Mm-hmm. You talked about food a little bit, high quality food. Now, I know there are, great high quality diets for like veterinary diets to address some of these issues, renal diets, urinary diets. Can you talk about the role that food plays in these diseases and like what makes a urinary food or a renal food what it is? What
Mm-hmm.
is the role that food can ultimately play?
Yeah, therapeutic diets are amazing,
I know.
because
Agreed.
there are many different medical conditions that are responsive to diet, or that a prescription diet may be recommended by a veterinarian. And some of those, like we just talked about, those two conditions, chronic kidney disease, feline lower urinary tract disease, there are diets that are formulated to be able to help cats with high quality nutrition, and also formulated so that they do not have particular ingredients in them that can contribute to the progression of the disease.
Hmm.
So, for example, for kidney diets, and it should be a high quality protein that the cats are getting, low phosphorus, low sodium.
Hmm.
The diets that Royal Canin provides can actually help with that. These are prescription diets, so they should be
Hmm.
recommended by the veterinarian. But it actually is a great option for being able to support, in addition to the medical care that's being provided. Diet actually does play a really important role in our health and for treatment as well.
Yeah, I mean, I know I'm always thinking about that with Ferguson because, as you said, phosphorus is a big concern for kittens and cats with kidney issues. And I wanted to mention too that there are also things that you can do, supplements, probiotics, like phosphorus binder. He's on. I had never heard of a phosphorus binder until having Ferguson, but there's actually things you could ask your vet about that can help. With the food and with some of the concerns around food as well. But this is why I think it's so important to talk to a vet because if you're trying to manage this at home, you don't have access to those veterinary diets, those supplements that might be helpful. And food certainly plays, I think, a huge role. And I know for Ferguson, I'm always trying to get him to eat wet food. Which he fortunately prefers because everything with him is about water. He actually tried to get in the bath with me the other day because I think
Wow.
he was like, wow, it's like a huge water fountain. And I was like,
Yeah.
no, 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 no. That's not what we're doing here today, Ferguson. So yeah, I mean, it makes a difference what goes into their body.
Yeah.
Water, high quality food, sometimes veterinary diet.
Hmm.
Um, so, right now we're supporting the Take Your Cat to the Vet campaign, which I think is really important. And obviously, we've talked a little bit about the importance of if you notice these signs, taking your cat in. But sometimes these signs might be so subtle that you don't notice them. So, how often should people be requesting blood work from a veterinarian, or how often are you recommending that people do just take their cat to the vet, even when things seem okay?
Yeah, that's a great question because if things seem okay, we still do recommend a wellness checkup as well. And so at Banfield, we recommend every 6 months to have your pet evaluated. And that's a nose to tail examination. It includes preventive care. It also includes diagnostic workup as well. Like I mentioned, sometimes things can change from, the last visit to, today's visit. So every 6 months. It also includes oral health assessment, dental care, and things like that. And at that
Mm-hmm.
visit, your veterinarian will be able to identify what's going on and when your next visit should be. So should it be another 6 months out, or is there some reason that we should be considering a visit more soon, in a shorter duration. So it really starts with the first visit. The first visit, preventive care, evaluation, overall health screen. We do have wellness plans at Banfield Pet Hospital, and that does provide a opportunity to have those examinations every 6 months, and it's included in that wellness plan.
Hmm.
And another benefit of that actually is that our clients, there's over 2 million clients that have the wellness plan, and they can use a service called Vet Chat. So if for any reason a client is wondering, something about how their cat is behaving, maybe something's a little bit off, they basically have their vet in a pocket, and they can, one-on-one have a chat with that veterinarian and identify, do I need to bring my cat
Oh,
in now? Or, is this something that can wait? So that also helps clients to be able to
that's
determine when their
amazing.
next visit will be. Yeah, it's a really great service.
I didn't realize you guys had that. That's so cool. I have for just like my human health, I have something like that that I love that's like a telehealth. You can log on to a computer on an app and talk to somebody and figure out like, do I
Mhm.
need to come to the doctor or not? But the fact that you can do that for your cat is incredible. That's so great. I'm
Yeah.
really happy to hear that, especially because right now it can be difficult sometimes for people to get to the vet or to get an appointment with a vet. So having a vet in a pocket is definitely really appealing and important. That's so cool. Well, I
Mhm.
just wanted to wrap up by asking if you have any kind of last words of encouragement or hope for people who are going through renal or urinary disease with their cat. Is there anything that you would say to encourage them?
Yeah, I definitely realize that when a cat has a lower urinary tract disease or chronic kidney disease or any other medical condition that might be presenting for some time, it can really affect, the family's lifestyle, and it can be a change. And so it's just very much appreciated, everything that you're doing to take care of Ferguson, and help others to see what kind of support is involved in that, and that you're giving your all. And I appreciate clients doing that, all of our clients doing the same thing. So we do everything that we can to help them with whatever they're going through. So I think you're giving a great example of that.
Thank you. Well, I couldn't agree more that these cats are family to probably everybody watching this feels that way. And um, any part of me that felt that this was overwhelming in the beginning just does not even feel like that at all anymore because it feels so worth it. And I wouldn't be able to have any idea what I should be doing without the guidance of my veterinary team that I'm working with for Ferguson. So I think, cat families and veterinarians are an amazing team. And I really appreciate you chatting with me today. I hope this was eye opening for a lot of people. And I hope that it encourages people to watch out for those signs and to get regular vet care. So thank you for all that you do.
Absolutely, thank you so much. Again, it's
Thank
it's just been
you.
such a pleasure. I appreciate the opportunity. Thank you.
Absolutely. Yeah. Thank you. Bye.
All right, bye.
Well, thank you everyone for watching. I want to thank Royal Canin again for partnering with me on this series, as well as the Take Your Cat to the Vet campaign. You can learn a lot more about that at royalcanin.com/cat health. So stay curious, stay compassionate, and please join me again next week for another really fun and educational episode of this new 4-part series, Cat to Vet Tales. Bye bye.